Good day, I'm Jimay Magahan from Union Christian College, your student nurse for today. And for today, I'm going to do a return demonstration of the bed bath. So now I have already done assessing the environment for safety, providing privacy for the patient, perform my hand hygiene, and I'm assuming that I'm wearing gloves as well. So before performing, don't forget to prepare all your materials at the bedside table. So assuming that this is a bedside table. So after putting our gloves and performing our hand hygiene, I forgot to insert the clip to the video, but don't forget to ask the client to check the temperature of the water if it's comfortable to her or him. Good day, how are you today? By the way, I'm Jemai Magahay, your student teacher today, and you are? So how about your age? Okay, how about your birthday? So, hello Maiko, how are you? So, for today, I'll be performing your bed bath or cleaning your body while you're in bed. So in order for me to do that, I am asking for your cooperation and your permission in order for me to do so. So, is it okay with you? Okay. Okay, Maiko, so before we start, what language do you prefer? Is it English or Tagalog? Tagalog. Okay, so start na tayo. So, unahin natin yung face mo. So, is it okay if I touch it? Okay lang ba? Nahawakan ko siya para magawa ko ng maayos. Yes. So, after asking the client to check the temperature of the water, we may now proceed to cleaning the eyes of our patient from the inner surface onto the outer surface of our eyes using the different sides of the cloth. So now we can now proceed to cleaning the face of the patient using the 3 patterns. From the forehead, going to the nose, and from the nose, going to the chin.
So in cleaning the face of our patient, we can use soap only if they prefer it. Remember that soap is drying and can irritate the patient's face.
So after cleaning the face of our patient, we may now proceed in cleaning the upper limb. So from distal to proximal. So from hand, going to the axilla of the patient.
In doing this procedure, we need to do a long strokes, as long strokes stimulate circulation by facilitating venous return.
So after cleaning the upper limb, we may now proceed to cleaning the abdomen of the patient.
Always remember to put the bath towel under the trunk of our client so that we may avoid wetting the bed. And also, put the bath towel over her chest to provide privacy. Remember that we can also change the water we are using to prevent the water from cooling down, and it might have been unclean and uncomfortable for the patient.
Now that we're done changing the water we are using, we can now proceed in cleaning the lower limb of the patient from distal to proximal also. So from the foot going to the knees up to the upper leg of the patient.
So in cleaning the lower limbs of the patient, we have to bend the knees of our client since this will allow us to have easier access to the top leg and to the bottom leg of the patient. If necessary, we have to provide pillow or cushion underneath so that we may able to provide support.
After cleaning the lower limb, next is we're going to clean the back of the patient.
Always remember to put the bath towel under the trunk of our client and put the bath towel over the chest to provide privacy. Then ask the client to roll to her side for us to have an easier access and vision of her back. Then note also for any skin indications, and we have to be careful in applying pressure when cleaning her back.
So after performing all the steps in bed bathing, we have to make sure that the client is comfortable, and after this, we can now proceed for documentation.